I'm Professor Dr. S. Natarajan, the Treasurer of International Council of Ophthalmology. I'm on a visit to National Institute of Ophthalmology at Pune. So here is Dr. Aditya Kelkar. We both are retina surgeons. Now Dr. Aditya Kelkar will tell about today's program.
So today is the World Diabetes Day, and on behalf of International Council of Ophthalmology, All India Ophthalmic Society, Maharashtra Ophthalmic Society, Pune Ophthalmic Society, as well as the National Institute of Ophthalmology, we urge the patients who have diabetes to go for a yearly eye checkup or as and when prescribed by the physician. It is important that the patients reach on time because there are lots of technological advances in the field of vitreoretinal surgery, but if only patient reaches on time, they will be useful to them. Thank you.
And we are also doing screening all over using the smartphone and artificial intelligence as an offline in the mobile phone. So everybody should take advantage of it. Thank you.
Thank you.
Hello everybody. Today is November 14, 2022. The entire world is actually celebrating as World Diabetes Day. And I am the treasurer of International Council of Ophthalmology. And I'm here at the National Institute of Ophthalmology with Dr. Aditya Kelkar. So we both are retina surgeons. So as a retina surgeon, we would like to say, if you are a diabetic, make sure you dilate your eyes, go to an eye doctor anywhere in the world, in India too, and check. If your retina is normal like this, the doctor will say, come back once a year. So every time, the time of onset of diabetes, kindly check your blood sugar, HbA1c, and check your retina. And then in case you have diabetes for 4 or 5 years, and then you may have some changes in the retina, and the doctor will advise a test called the fluorescein angiography. This is from thanks to this ultra wide field 150 degree from MC color mode, where Microclear Medical CRO has given this, where you see the fluorescein angiography, which shows a very minor change, but these sort of changes, you don't need to treat, you only observe. And in this picture, you see the black areas on the top of the picture, which shows there is no circulation. And there's a whitish thing which is actually the leakage of the dye. That means there's a new blood vessel which is forming, which is unwanted. And when you bend down, suddenly the new blood vessel can give rise to bleeding. But this situation, the patient will have normal vision. Many times in India, even whether he's a rich or poor, educated or uneducated, either in village or in urban or in slums, they think that the doctor is telling, oh, I need a treatment. But this patient needs what you call as pan-retinal photocoagulation to maintain the vision. He's already got normal vision for distance and near. So when you do this test, you'll know. And sometimes you can have changes like this this is a retina photograph, which shows optic nerve, macula, and the entire periphery. There are yellow spots are seen, which means the patient has got diabetic maculopathy. We do a test called OCT. All this expenses the patient or the government or somebody has to do, either an NGO. And instead of doing all this, if you do a screening and if you go check from the time of onset, I think you can prevent all this expenditure and also have a healthy vision and a healthy life, and you can live 100 years and see normally. And here you see there's a blood vessel which is growing from the optic nerve, the center red spot, and that is called proliferative diabetic retinopathy. And these sort of patients need laser photocoagulation. But again, the patient says, I don't have any complaint. Why should I go to a doctor? So whoever sees this video, I request and I urge that you should have a retina eye checkup, either in a government hospital, free, or in a PHC, or in a private clinic by paying. And here you see, if you don't treat, still the macula is all right, but there's a fibrous tissue growing, and which can produce fractional detachment, which is dangerous because suddenly you can lose the vision. So my entire dream in India is to make India and the whole world diabetic blind-free India and diabetic blind-free world. And for this, you have to do your duty of going to an eye doctor. And here you see the hazy picture because of vitreous hemorrhage and tractional detachment. And if you don't treat, you may need a sophisticated operation. Myself and Dr. Aditya Kelkar, we do 3D vitreous surgery, but a 3D costs 3 crores or more. And then like that, vitrectomy machine costs more, laser costs more, and patient has to spend. And that time they say, I can't spend, and then they may go blind. So, and on this day, I request everybody to have a eye checkup, either free or by paying, and anywhere go to your eye doctor, get it done, and let us all have healthy vision, good vision, and healthy life. Thank you.